Good morning, medical students. Today, we will explore optic neuritis, an eye condition characterized by inflammation of the optic nerve. We will discuss its causes, symptoms, and treatment options. Let's begin. Optic neuritis causes inflammation in the optic nerve, resulting in its degeneration. Demyelination, axonal injury, mitochondrial dysfunction, and immune-mediated processes all play a role in this condition. Identifying these mechanisms is important for effective treatment strategies. Autoimmune processes are thought to play a major role in optic neuritis. Diseases like multiple sclerosis and neuromyelitis optica spectrum disorders are associated with optic neuritis due to the immune system mistakenly attacking healthy tissues, including the optic nerve. Understanding these underlying mechanisms is important for diagnosis and treatment. Infections, such as bacteria, viruses, fungi, and parasites, can cause optic nerve inflammation. Lyme disease, tuberculosis, and herpes viruses are common culprits. Recognizing these infections is important for accurate diagnosis and treatment. Optic neuritis typically presents as unilateral vision loss. However, bilateral optic neuritis, characterized by simultaneous inflammation of both optic nerves, can pose diagnostic challenges. Bilateral involvement can occur simultaneously or sequentially and may result from a variety of etiologies, including autoimmune diseases, infections, inflammatory conditions, and toxic exposures. Differentiating bilateral optic neuritis from other causes of bilateral vision loss is essential for guiding management decisions and determining prognosis. This clinical presentation warrants a thorough evaluation, including detailed medical history, neuroimaging, laboratory investigations, and consultation with other specialists when necessary. Recurrence of optic neuritis is common and can be challenging to manage. Risk factors include multiple sclerosis, specific HLA genotypes, female gender, non-Caucasian ethnicity, and bilateral optic nerve involvement. Identifying these factors is crucial for prognosis and treatment. Strategies to reduce recurrences involve lifestyle changes, immunomodulatory therapies, and close monitoring. Managing recurrent optic neuritis can improve vision and quality of life. Optic neuritis can occur alongside systemic disorders such as inflammatory bowel disease and sarcoidosis. It's important to recognize these associations, as a multidisciplinary approach is often needed for evaluation and management. Steroids are commonly used to treat optic neuritis, but the best dose, duration, and way to give them are still being studied. Short courses of steroids are generally safe, but long-term or high-dose treatment can have side effects. Deciding on the right treatment plan depends on the patient's condition and potential risks. Although steroids are the mainstay of treatment in acute optic neuritis, various immunosuppressive agents have emerged as alternative or adjunctive therapies. These medications target different pathways of the immune system and can be considered in cases of severe or refractory optic neuritis, recurrent episodes, or in patients with contraindications or intolerance to steroids. Examples of immunosuppressive agents used in optic neuritis include azathioprine, mycophenolate mofetil, methotrexate, rituximab, and others. Understanding the mechanism of action, efficacy, safety profile, and appropriate indications for these medications is essential for interdisciplinary collaboration and individualized patient care. Optic neuritis occurring during pregnancy poses unique challenges for both mother and baby. The physiological changes during pregnancy, including hormonal and immune system modulation, can influence the course of optic neuritis. Treatment decisions need to consider the potential impact on the developing fetus while ensuring adequate management for the mother's visual function. Balancing the risks and benefits of various therapeutic options, including steroids and immunosuppressive agents, is crucial in achieving optimal outcomes for both mother and baby. Close collaboration between ophthalmologists, obstetricians, and other specialists is essential in navigating the challenges presented by optic neuritis during pregnancy. Optic neuritis can occur in elderly populations, presenting distinct clinical features and management considerations. Age-related changes in the immune system and underlying comorbidities can influence the etiology, course, and prognosis of optic neuritis in older individuals. Differential diagnoses, including non-arteritic anterior ischemic optic neuropathy, NIAN, giant cell arteritis, and compressive optic neuropathy, should be carefully considered due to their increased prevalence in this age group. Age-appropriate diagnostic evaluations, management strategies, and multidisciplinary collaboration are necessary to optimize visual outcomes in elderly patients with optic neuritis. Chronic optic neuritis is persistent or recurrent inflammation of the optic nerve, while optic atrophy is irreversible damage leading to permanent vision loss. Investigating long-term consequences is important for predicting outcomes and developing treatments. Optic neuritis can mimic various other ocular and neurologic conditions, leading to diagnostic challenges. It is crucial to differentiate optic neuritis from other conditions to guide appropriate management and prevent unnecessary interventions. Differential diagnoses for optic neuritis include non-arteritic anterior ischemic optic neuropathy, compressive optic neuropathy, diabetic papillopathy, toxic optic neuropathy, and others. Clinical features, neuroimaging findings, laboratory investigations, and ancillary tests help differentiate optic neuritis from its mimickers. Recognizing the clinical pearls and red flags associated with differentiating optic neuritis from these similar conditions is essential for accurate diagnosis and optimal patient care. In conclusion, optic neuritis is a complex condition involving various underlying mechanisms. Recognizing its pathology, understanding autoimmune processes, identifying infections, and differentiating bilateral cases are crucial for accurate diagnosis and management. Considering risk factors, systemic disorders, treatment options, and unique situations is paramount. Future ophthalmologists have a crucial role in improving the lives of those affected.